Diabetes Awareness Month 2020 ZJB Radio interview with a podiatrist, Deidre Bramble. Hi, my name is Deidre Bramble, and I'm a registered podiatrist. This year, as part of Diabetes Awareness Month 2020, I had the pleasure of being interviewed by ZJB Radio host, George Piper. Together, we discuss all things diabetes and feet. And in this video, I'll be sharing that with you. Now, who doesn't love walking barefoot, especially on the beach, right? So no matter what diabetes diagnosis you're currently living with, you're going to want to stick around until the end of this interview to find out if barefoot walking is for you. Let's take a look.
Hello, everybody. My name is George Piper, JGP, and I'm speaking today with none other than Miss Deidre Bramble, one energetic young lady. Hello, Deidre. How are you?
Hi, George. Thank you so much for having me on today.
All right. So you are a podiatrist.
Yes.
Right. And tell us a little bit about yourself.
Sure. So like you said, my name is Deidre Bramble, and I was born on the Caribbean island called Montserrat. And my family are from Gauges. My mom's name is Debbie Bramble, and my stepdad's Peter White. We actually left the island in 1997 after the Zephyr Hills volcano erupted.
Right. Now, what exactly is a podiatrist? What does a podiatrist do?
Well, this is a very good question because people often get orthopedics and podiatry confused. So just to say, orthopedic is the surgery of the bone. And although both professions actually treats, conditions, the same conditions actually of the foot and ankle, orthopedics, their treatment methods is often always about surgery. Whereas a podiatrist, we focus on, general foot care, diabetes foot care, orthotic therapy, wound care, and education. And surgery is the last option for us.
All right. You touched on the diabetic foot care business. That's been a big topic over the years. And I mean, you're still pretty young. So what encouraged you, what made you go into that? Being a podiatrist?
Well, it's quite an interesting story, but I will keep it short. My education actually started out in engineering. And throughout that time, I found myself in a position where I actually wanted to go back and do nursing. And then I remembered when I used to give my grandfather his daily insulin injections in the morning. And I just thought, I'm going to be doing this for the rest of my life. So I actually said goodbye to engineering. I did some shadowing of other healthcare professions. And then that's when I came across podiatry. So I went back to train for 3 years, and then I did some postgraduate training in diabetes.
Now, over the years, and we've been hearing, even right here in Montserrat at the time, we've been hearing about diabetes. We didn't know what it was. And one thing that always seemed to come up was this thing about the feet, being a diabetic and your feet going bad, whether getting a cut or naturally from being a diabetic. Mm-hmm. Why is foot care so important for diabetic persons?
So just quickly, for those who are not familiar with diabetes, so diabetes is caused by really high glucose levels in the bloodstream. So glucose, example, sugar. And if it's not controlled properly, it puts you at risk of losing your sensation, which often starts in your fingertips and your toes. So that's why you've got to be extra careful when you do have diabetes.
All right, because we've been hearing about that. And then you tend to wonder how come you don't hear a lot about overall body care, but you always hear about the feet. What is so specific in your terms of work and caring for the feet, especially of diabetics?
Yes, so one of the things that we look for is called peripheral neuropathy. So like I said, it's losing the sensation. if you lose the sensation in your feet, it puts it at risk of trauma. Now, if you were to, step on something sharp, for example, you won't be able to feel it. And if you can't feel it and that goes left untreated, you're at risk of ulceration. Now, if that ulcer goes on to become infected, once that infection gets into the bone, there's no other option than to amputate or sometimes even death.
Okay. What about footwear? How important is that?
Footwear is really important because remember, you're spending most of your day inside that shoe. So you want to make sure that you're comfortable. So an ideal shoe is something that has ample cushioning inside it. So that means, a thick insole that's soft, that's going to give you that cushioning that you need as you progress throughout your day. You also want to make sure that your shoes, hold your foot in a stable position. So you want to make sure it's got laces or Velcro. One of the things that if you have really like a bunion, for example, or you're having, a risk of ankle sprains, your healthcare provider might want to prescribe you some orthotics. So you want to make sure that your shoes can accommodate all these extra treatment that they might want to provide for you.
All right. I'm speaking with podiatrist Ms. Deidre Bramble, and generally just letting us know some of the things that are important for overall foot care, podiatrist yourself, and especially looking at diabetics and foot care. Speaking about that, what are some of the things you do offer in terms of physically doing it for patients, for affected persons, or even advice? What are some of the things you do if you had to do these things?
Okay, so what I want to highlight here is no matter what your diagnosis is, even if you got a diagnosis of being pre-diabetic, you have a diabetic foot, so you have to look after it. Make sure your GP or your healthcare provider actually refer you to someone so that you can get annual foot checks. So when you come to see a podiatrist, one of the things we focus on is really looking at your skin, make sure that there's no dryness, cracks. Again, your sensation, which is very important, and your nail care. Because remember, if you start trimming your nails incorrectly, you put yourself at risk of infection.
All right. If somebody were to come to you, let's say, and you're doing a test, what do you do? Do you squeeze their toes or fingers to see if they can feel?
Yeah, so there's quite a few things that we can do, but to keep it simple, we have something called a Doppler. So we listen to the blood flow going through your arteries. So there's two arteries in the foot, one called dorsalis pedis and the other one called posterior tibialis. Now, you listen to those with the Doppler to make sure that there's no blockages, or you can use your fingers palpating them. Sometimes it can be difficult because there's 10% of the population who actually have an absent dorsalis pedis, and that's why they will bring in a Doppler. We'll also check the temperature gradient. Sometimes one leg might be warmer than the other. That can be a sign of a complication called cellulitis. We also assess your shoes to make sure that there's no wear and tear. So we'll put our hands inside the shoes to make sure that there's no sharp edges and make sure it's smooth, make sure that the insole, the cushioning hasn't been worn away. We also do hot and cold testing because when you're having a bath, for example, someone with diabetes, you can't use your hands to check the temperature of the water. You'd have to use your elbows or get a thermometer. So they're the key things we look for.
We would hear certain words and we associate them with certain parts of the body. The regular person hears the word ulcers and probably think about the stomach and so on. You as a podiatrist would hear the word ulcers and right away you tend to think of what?
The feet, yes.
So feet, you could get ulcers in your feet as well?
Oh, absolutely, because remember, if you lose the sensation in your feet and you walk on something, yes, it might start with something small as a cut, but then over time, especially if you don't know if it's there, it gets worse. So if you keep walking on that small little cut, the body kicks in as a defense mechanism and then puts extra skin on that particular area to try and protect it. Then by the time you get to us and then we see a small little cut, we'll have to debride all that extra skin, and that's where the ulcer is being revealed.
Wow. So it's
Does
not
that
as
make sense?
simple as, not as simple as just saying, oh, it's ulcers, you just go here and get it done.
No.
Oh. All right. In terms of factors, all right, in terms of risk factors that could herald, could let people know, like indicators. What are some of the risk factors that are there that could indicate that, hey, we're getting into a certain level of diabetes, being affected, your feet going bad? What are some of the indicators or factors?
And that's a really good question. So I would say definitely footwear, really bad footwear. And if your sugar levels are not being controlled. Also, if you've had a previous history of ulcers, there's a chance that it can come back. Lack of family support. And also, we find that men in particular are more predisposed to getting an ulcer because they're non-compliant compared to females. And if they've been married as well for a long time and they were to lose that loved one, they tend to do things to their foot to actually come back and see a healthcare provider. And also lack of education. People are just not aware of how to look after their feet themselves at home.
All right. Okay. Well, basically, how do you prevent foot ulcers? Basically.
Yeah, so there's a number of things that you can do. And the number one thing is to make sure that your sugar levels are really controlled. So be compliant and take the therapy that your healthcare provider gives you, whether that's oral treatment or insulin. Also wearing really good shoes, no barefoot walking, and checking your feet daily. If you can't do it yourself, get someone to do it for you. And going to get someone to actually do regular foot examinations, at least twice a year.
You just mentioned no barefoot walking, and there's been and you know about that, the old adage of walking barefoot sometimes, which is good for your body, makes your body natural, it does this and does that. So yeah. Do you still say you could walk bare feet? Well, let's take it one category at a time. Persons who are non-diabetics at the moment, can they walk bare feet, but be careful where they walk, first off?
Yes, they can. I still say no barefoot walking to anyone just because of the risk of trauma. You don't want that. But yes, they're okay because they'll be able to, if they walk on something, they'll be able to jump and put their foot in the right position, unlike someone with diabetes who may have lost that sensation in their feet.
All right. Probably somebody will be listening to us and thinking, okay, no, she kind of messed up my beach foot. Going to the beach and being afraid to walk. Walking on the beach, let's say the beach, that's okay once it's smooth sand and things like that?
Yes and no, because one of the biggest risks as well of losing sensation as a diabetic is getting an exploding foot. And when I say that, I mean, it's called charcot. So basically, sand it might be even, but it can also be uneven. And all the bones in the midfoot can actually shatter. And then you're at really, really, really high risk of a lot of complications. So I would say no sand walking or barefoot walking on the sand if you're a diabetic.
Wow, that's a lot of information to take in. How can people get to you? How can people find you in terms of all this invaluable information? Give us some contact information.
So if you'd like to get in touch with me, you can find me on Instagram. My Instagram handle is at DEIDRE Bramble.
Thank you so much. That's a lot of information, people. Really, really informative information. Coming there from Miss Deirdre W. Bramble, and podiatrist, like I said before, energetic lady. So she'll be giving you a lot of this advice, words of wisdom in a rather positive, upbeat manner, and making you feel that it's not all bad news for persons suffering from diabetes, right?
No, it's not all bad.
Thank you so much, Deidre. Have a good one.
Thank you, George. Did I surprise you about barefoot walking on the beach? Let me know in the comments. And while you're down there, go ahead and like this video, subscribe to the channel, and hit that notification bell. If you have any questions whatsoever about diabetes or your feet, please send me an email, or you can direct message me on Instagram, and I'll be sure to answer. Until next time, take care.